Hello, and a warm welcome to everyone joining us for our Cryotherapy in Physiotherapy webinar. We're incredibly excited to have Mr. Ralf Mühlhäuser with us today. Ralf isn't just a professor at Ulm College since 2004. He's a hands-on expert with years of experience working with athletes in sports ranging from soccer and boxing to ski jumping. With a PT diploma from the University of Heidelberg, his focus on manual therapy and sports-related issues makes him uniquely qualified to guide us. Get ready to unlock the potential of cryotherapy. Please welcome Mr. Ralf Mühlhäuser.
Good evening, everybody. On behalf of Simmer Academy and Healthcare & Co., I would like to welcome you to our today's presentation. We're going to have an overview about cryotherapy, where we are today, where we have come from, and where we are going to. Give me a moment to share the screen with you, and then we can go ahead with the presentation. So, for the options you have, we have the presentation, which we will run through as quickly as possible. As I understand, your time of the day is 8 o'clock in the evening. Here in Germany right now, we are at 7 hours behind you, meaning that we have 1 o'clock straight after lunchtime in the afternoon. So let's go, let's get it started. I'm sure healthcare, you let me know if there's any kind of topic problem with the presentation, you cannot see it or it's going to be delayed. Please just let me know. So I'm going to be the person to give you a brief introduction, and thank you already for the nice introduction from the side of healthcare. I don't think I have to talk a lot about me as a person. If you have any question, feel free to come back to me after the presentation. So, potential of cryotherapy, how to unlock it, where we are right now, where we have been, where we go to. So here we have different parts of cryotherapy, what we use in sports, what we use in rehabilitation, what we also use in well-being. It's also a big portion of the therapy nowadays. Let's say in sports, we say after the game is before the game, meaning that anytime we are at a certain level of performance, we have the competition, but then we're already back again in preparation to the next level, to the next competition, what we do. The records of using cryotherapy date back 2,500 years from the Greeks, where they used ice to work with pain. And over the years, what we have seen is that, especially during the French wars in the 18th century, with Napoleon and his doctors, which was back then a very advanced medical clinic, advanced medical doctors, they used the cryo to cool down limb parts before they had to remove them. In the 1890s in Germany, more or less, we had Mr. Sebastian Kneipp, very famous person here in our region, talking a lot about cooling, also heating was one of his topics. He was working a lot with water, cold water, warm water. In the 1960s, around about 1970s, we had Dr. Yamaguchi from Japan introducing the whole body cryotherapy, the WBCT, to deal with multi clinical issues in one person, more or less polyarthritis, what we're talking about today. How can we work or help these people to have less pain, more improvement in their activities of daily living, and have a better overall living with less drugs and medications. Cryo. Nowadays, again, how we use it, what we do is for you, maybe sometimes in the morning, you are also clinicians, you have already heard about how to work with hot and cold, how to activate your metabolism, how to activate your cardiovascular activity. You know about hot, cold shower in a mix can be very, very helpful to activate the body early in the morning. The next slide you see is what we call water walking, as we do it in a special temperature water, which is kind of cold. Next slide is next photo is the ice bath. Wim van Hoff is here, one of the persons who is kind of making it popular around the globe, having people sit in a pool with a low temperature of around about 5 to 8 degrees and really stay in there for 2 3 minutes. In sport, we use it also in a very, very active way, not just sitting in there, but also moving inside of the water. Other picture, ice bathing, um, which is kind of common in the regions where they have a lot of ice, where they have the sauna also, where I have in Finland, Scandinavia, where they use like the cold water right after the sauna. We have the ice packs. And last but not least, what we're also going to be talking about today is in therapy, what we use in terms of cold air. Well, what we are facing is we're working on training, we're working in sports, we're facing to some degree overload issues, followed by injuries or disorders, or vice versa, having an injury at the beginning, resulting over the time in disorders, which is kind of common if you look at the runners nowadays. We have many, many runners out there in the world since 10, 15 years, the big marathons out there. We have many people who use their body to an extent, to some level, which they have not been trained for. And even if they have been trained for, what we see in pro sports is that there is a certain limit to each one of us. The limit says at a certain intensity, training load, performance load, I can only do the running until my body tells me the limits have come, which then results in typical overload load problems like runner's knee, like an Achilles tendinitis, where we say, of course, we try to see, okay, is it really an overload? How can we improve it? Do we look at the shoes? Do we look at what kind of additional training we can do to make it better? And then we go back into prevention, training, sports, so on, so on. So this is more or less a continuous circle of what we do. In sports overall, again, keep in mind we're talking about preparation, performance, and regeneration as the major pillars in on the medical side. Saying, okay, preparation deals with pre-cooling, especially if we look at the hot spots in the world, like Australia, can also be Africa, the US, Mexico, wherever you have these kinds of places, or you are at these kinds of places. They use cooling vests. They use specific tools to cool their body. They have garments which work that. And then, of course, and the regeneration part, we talk a lot about having these high performance cooling parts as a cryo machine. Preparation, of course, training, work on the problems where before the competition, we have to get the body at heating up, but not losing too much fluids. During the performance, we want to keep the body cool. We don't want the fluids to be lost too early. Regular competition in sports, ball sports related, is minimum one hour, whereas at a certain level, of course, everybody is losing, is getting dehydrated, and we have to find a way to keep the body at a certain temperature. Therefore, the body starts to sweat, but we can help the body also with different garments to reduce that kind of loss. Regenerative part, of course, we have to make sure that the body overall, the inflammations which are being created are being dealt with in a positive way. And there we need really at the beginning right away cooling to reduce the pain level, to reduce also, of course, the swelling, and therefore overall have over the night an increased vascularization, mostly of the limbs, mostly of the legs, as this is our main focus with most ball-related sports. In our clinic, or in your clinic, or in typical musculoskeletal clinic, this is kind of what we see in our daily routines. We see elderly people, right photo top, with polyarthritis, where we have hematomas, people falling down, work related. They have an injury during the work, going to work. We have sports related injuries like an torn or ruptured ACL. We have post surgery wise, of course, these typical knee prosthesis, what we talk about. We really have to see, okay, how can we get or improve the situation for the people. Right photo below, of course, basketball, typical injury, sprained ankle. And I think the pictures were a little bit delayed here. You see them now. Typical pictures again, polyarthritis, hematoma at the shoulder, sprained ankle, ACL, and the knee injury. What do we do? Yeah, well, of course, we have our best practice, what we work with. We have like these different protocols we follow since a few years, and most of the protocols I think are familiar with you, or you are familiar with. It's RISE at the beginning, then we were talking a little bit more about the price, then we're moving into the police. I think everybody agrees on RISE price, pause, rest, ice, compression, elevation as the main targets straight after the injury, or if we have an ongoing acute disorder. Police is becoming more interesting because this is now really focusing also on loading. Loading strategies are more or less what we call the key to a solid ongoing performance of the athletes. At what point we can apply what kind of loading to the tissue and what will be the reaction of the tissue that the person can work out very well and can have a good performance in the pitch, right? Nowadays, since I think it was 2019, Dubois et Escudier, two French guys, have come up with the peace and love, which is a very nice way to put it. Peace and love is really something also what medical staff people stand for, right? It's not just about to make money. It's also really about we want to find a way to help the people. We want to share our experience with them about how can they get better not to be so much in pain. So we have the words peace and love, protection, elevation, avoid NSAIDs, compress, educate, loading, optimism, vascularization, exercise. So I want to point out that optimism, motivation, positive attitude is also, of course, a very strong driver in rehabilitation. That the people after an injury and with pain, they're scared, don't know what to do. And we have to make sure that the fear avoidance belief what we see sometimes in people is it's not increasing. We have a lot of mental work to do at the beginning to really keep the people at a certain level to say, okay, you got a pain. Pain is coming from the inflammatory status, the acute inflammation. The body is trying to repair what you got. He's opening up all the blood vessels. We have a lot of alert mediators going on, happening, really trying to improve the situation. Therefore, the body has to clean it up, right? That's the main part at the beginning. The body is actually inducing this kind of inflammation. The interesting point maybe to talk about maybe also later is to avoid NSAIDs, meaning like non-steroids, anti-rheumaticas, which have after quite a while the side effect that the collagen proliferation seems to be really inhibited, meaning that that at a certain time, let's say after 10 to 14 days, when the body really starts proliferating the tissue again, could be a little bit earlier, could be a little bit later, but more overall, this is around about the time when we look at that, we lay this back then, we have to really reduce this kind of painkillers because they can have a negative effect on the stability of the tissue on the long run. Again, keep in mind these two words are kind of important or important parts of the new approach of peace and love. Avoid NSAIDs, loading we already had on the police side, but optimism and also vascularization, how to work with vascularization. At the beginning, we want to keep the vascularization lower. And later on, in the time when it starts proliferating again, creating new tissue, then we start step by step to work with vascularization, stronger vascularization than before. So what is our topic here? Just want to quick healthcare, guys. We're good with the presentation. Everything is working nicely. I think yes. I don't see any other feedbacks. I continue. So we have on the side of when we talk about the pain, we talk about, of course, how the pain is being promoted, what's going to be happening. Peripheral nociceptive pain is typically what we look at. So we have like some kind of injury. The body is reacting to this injury, inducing an inflammation, which is like a chemical inflammation, what we see there, mechanical followed by a chemical. And in that way, what we look at is, of course, that where can we really help the body? What can we do? First of all, of course, where the source of the pain is, we can reduce the chemical aspects, what we do in that way with cold air. Furthermore, what we do is that we try to interrupt or reduce the activity of the nerve fibers to really have the pain reduced. And the last approach is, of course, what we see over the last years more and more, especially looking at chronic disorders, is that we start to work on the brain. So the brain is going to be reacting to some kind of pain mechanism, and therefore we can also unlock these kind of mechanisms by working more on the brain, which can be like what we use in whole body cryotherapy, like a mechanism when we deal with the complete body. We make the brain release some of, for example, some endorphins, some hormones, which then really help the body to improve the part of the body, and overall to have a better feeling, better part of vascularization, to really have a reduced level at the end. Some of the points, again, what we found over the last years in terms of what is cold really doing. Overall, what we see is that, first of all, we have the reaction at the pain sensors. We have the reaction at the level of the cells, the chemical parts or the chemical activity is going down. Furthermore, what we see is that the conduction of the nerve fibers, the transmission is also going down. So here we talk about what we call a thermic shock, that we reduce the temperature in a very short amount of time by 20 to 30 degrees. Really bring down the temperature. We have like a sort of, we create a counter irritation effect, which really takes down the body reactions and helps it to recover better. Which we also see in neurology, where the body is going to be cooled with ice to reduce the effects of having, when they to some degree have a surgery at the open brain, the open skull, is that we really reduce these effects from the body itself. Local analgesics, of course, what you see here in this graph, you see the comparison of injections, cryo, cuff, and control, which means that overall what we see that is the cryo on the long run is having a stronger effects here. The vasomotoric effects, we talk about what is called like a hunting reaction. As we drop the temperature very, very quickly, we have like a thermal shock, which takes down the temperature and at the same time takes away the pain right away and has a long-lasting effect of a few hours, in terms of that the chemical aspects are not so strong that the people are more or less all the time in pain. Anti-inflammatory effects. What we see here is what we call the CRP, the creative protein concentrations rise and fall with pre and post surgery. And also here we see like a very, very good and solid effect for the cryo cuff. I mean, like the cryo in terms of having really a combination of compression and cooling. We not just work only with cooling, but we also work with compression and cooling. Sensory effects. We have a gait control effect. We have a motorical effect furthermore, meaning that the motorical activity is really slowing down. So we have a reduction of the sympathetic tonus, and furthermore, we also have a reduction of the blood flow inside of the tissue. Trouble and symptoms is one of these words. What we know is about the spray and stretch. We use like the cooling also to have a positive effect that after 30 seconds the motorical aspects are going down. So we do a combination of cooling and stretching the same time. Conduction of the nerves in terms of speed when cooled is that the velocity of the nerval parts of the nerval activities is really going down big time when opposed to cold. But what are our ways to cool? What are ways to cool down the tissue? Well, we have starting on the top, we have a very strong cooling options in terms of cold air, gas, which goes down to minus 140 degrees. We have what we call an ice lab, a cold chamber. We use the ice to cool partial body parts. Working with cool pads, we have temperatures of maybe minus 25, minus 10, which is rapidly increasing. So the cool pad has lost in 10 minutes has lost almost 70% of its cooling capacity. So there's no real stable cooling, what we need for real arthritis, for real pain management situations. Um, for the water, depending on the water temperature, it's getting better. Then we have a more stable because we have the volume of the water is a lot bigger, but then it's depending on the outside temperature, how quick is this getting warmer. But of course, the water is, especially if you have it indoors, is a very good option to have this cooling really working very well. And last but not least, we have the evaporation, which can be done by gas, which can be done by water, ranging of plus 15 to plus 7 degrees. Excuse me, that was too quick. Cold water walking. Something what we do quite frequently. You know, here in Germany, we have quite a bit of water. We have many rivers, big ones, small ones. So in the region here, what we have is that we have here the Danube River, but also a smaller river like the Blau and like the Iller. And what you see also lakes. And what you see is that sports people do their training, and right after they have done it, they go into the water. And especially, it's the best thing, of course, to go into cold water. The water should be below 18 degrees. What we do is that beginning, if the water is very cold, below 10 degrees, you start with 20, 30 seconds. So the body has step by step to adapt. And this vasoconstriction, motor activation, what we see for the blood vessels, need roundabout 1 to 2 weeks minimum to adapt to this kind of therapy. Meaning that the first 1-2 weeks, you should really go step by step, meaning that you shouldn't go too long into the water at the beginning. You should do it maybe once per day, not more frequently. Other people over the time, or once every second day, let's put it that way. And then you go for 2 daily, and then you go for twice a day. And you combine it with sensoric activation afterwards. So it's really going to be rubbed. It's not going to be dried, but it's really going to be rubbed with a very strong towel. So you have a very strong also pressure activity. Afterwards, the body should not be warmed. So you shouldn't go into a sauna, or you shouldn't go into a steam bath or anything like that. The one thing you should be doing is you should be covering your limb. Take on pants, take on socks, and then you should start walking. And you should start walking for minimum 2 to 5 minutes after the use of cold water. And this is pretty much also going similar to what we know about the ice bath. The ice bath should be, if you've never done it before, you should actually start with water walking at the beginning. So it's about training the vasomotoric effects. And these training situations need like 1-2 weeks to have a very, very good adaptation. If you don't have that, of course you can try, but you should be, if you look at the ice bath, you should be careful doing this. Temperatures are very low. You should start, of course, more in combination with a sauna. You should heat up the body before, so that the blood vessels are already activated and your body, your cardiovascular system is already very activated. This is very important before you go into this kind of different temperature, because the temperature shock can be a lot stronger with the whole body inside. And keep in mind, the water is expelling the temperature from the body 5 times quicker than the air. Meaning that if you go outside when it's cold and it's just the air, the cooling is not as strong. The reduction of the body temperature is not as quick as if you jump into cold water. Here, the reduction is really that in the situation, what the young gentleman is doing there is that if you're not trained, after 2-3 minutes, you might run into a cardiovascular episode, crisis, which means that the body really is pumping, and pumping very hard, and to some point can come to a risk. You can, of course, adapt it also with gloves, with head protection. Here again, point is that it has to be followed by movement. Don't go into the heat afterwards. Just really get the body dry, cover it, and start moving. That's more or less what we see like for all interventions. What you see is that don't try to heat it up afterwards. Really make the body heat it up again, which has a stronger effect on the motoric blood vessels. So what we have on the positive, on the heat side, what we have on the cold side is that, of course, at the beginning, you have, when you go into the cold, you have a blood movement. And the blood movement is that your body tries to keep the inner organs well prevented with hot blood, and the extremities are going down. So you have a strong blood movement, cardiac activation, vasoconstriction, and stress reaction, which is then followed by the other way around, by a blood movement, vasodilatation, endorphins, relaxation, anti-inflammatory effects of the body. Whereas the anti-inflammatory effects of the body, especially, and this is an important point, is really when you are really working whole body cryotherapy wise. The endorphin reaction is really at that moment when your complete body is being activated by this cold. It's not going to be activated by what you see here when we use like a very low temperature at a limb. So here we use like temperatures which go down to, or the air, what we use here goes down to minus 30 degrees, and it creates this thermic shock on the tissue what we use. Advantage here is that when we talk about dry air, we don't talk about ice and we don't talk about water. It's really dry air, which has another effect than excuse me, than the water. Here's some basic informations about use of cold air. We have a very strong effect. We'll say the temperature is really dropping down quite a bit. We're talking about the Huntington reaction. We're talking about really the drop of the temperature by 20, 30 degrees, where we need to have this thermal shock. Cold air, of course, is cold air, which means that at a certain distance, the temperature is going up or going down, meaning that the closer you are, the more cooling you have. For short-term cooling, we use a very short distance of 5 centimeters where we do travel Simmons, spray and stretch. We work on the tissue, really work on the muscle itself for up to 30 seconds, high intensity, very strong cooling, and then we go into the movement, then we go into the stretch, then we work with the tissue also manually. Here for these kinds of things, also when you work with cold air, it's about the fan speed, it's about the temperature, what we have on this, meaning that distance plays a role, and furthermore, what plays a role, of course, is the speed of the air, meaning that the more speed you have, the more body temperature will be pulled away. About the timing, what we have is spray and stretch. Keep in mind, we'll talk about around 30 seconds, short distance, midterm, post-injury, hematoma. It's repeated many, many times. This kind of very short interventions and followed by a long intervention, a long passive intervention of 15 to 30 minutes. Mid long term, post-surgery wise, we talk between 20 to 30 minutes. Long-term cooling arthritis, the same thing. We can use it during the therapy, cooling it, having a stable temperature, and then afterwards really having the cooling done. Some people also go the other way around. They start with the cooling right before the treatment, which then can lead to some hyperemia during the treatment, which then can lead to, for short term, to some increased pain. Or at the end of the day, what we want to see is that we cool it at the end, long term, and then cover the body part, and then let it warm up step by step. What you see here on the left side is a typically what we had here. We did like some photos for some patellar knee pain. We talk about, of course, activation of the muscles, and this is from positive aspect of cold air. We say we can combine the cold air with movements. We can combine it also with other modalities, for example, like with the use of the shock wave. And there we have limits of the cool pack. This is to some degree, of course, something where we're kind of limited in terms of how to use it. You see, like the distance to the skin, what are the advantages, the mid-temperature range, and the diameter of the mid-range temperature, overall the temperature on the skin after a few minutes. So the further away you get, the more stable is the temperature. Now we have to keep in mind, are we cooling a joint or are we cooling a muscle? If we talk about a joint, of course, the reheating capacity of the body is lower than if we work on soft tissue, like we work on a muscle, on a hematoma, where the vascularization is a lot stronger than that for a joint, where we can work with a lower temperature there with the air than on the joint. We can go there 5 to 10 degrees lower on the muscle than at a joint. Furthermore, what we can do is, of course, we can also with cold air, we can have like a complete garment, a complete small compression with cooling of the complete limb post-surgery wise. What we use in rehabilitation, really post-surgery, we have many clinics working with knee injuries or knee surgery, where they have like a big loss of blood, small loss of blood, minimal invasive open surgeries. Here, the advantage of the cold air is that the temperature is kept very, very stable at a certain level. And we can adjust this temperature also. There are ways to really have a temperature controlled cooling. We control with the capture of the temperature, the temperature on the skin. And this is a kind of an interesting thing, is what we don't have when we use an ice pad. Here we know, again, vascularization is an important part. We have our sports people. We know that they're very, very active. They're very good. They have a high body performance. They have a very strong vascularization. So if I have a young person, 25 years old, basketball player, and I put a cool pad on his leg, of course, I will not run into dangers as compared to an older person, like grandma from next door, and I put a cool pad on the skin. This might lead to a freeze burn, because we have to adjust, of course, the cold also to the person who is in front of us. And a cool pad can, especially for elderly people, can be a really, really big problem. Also, if they have maybe an additional side disease, for example, something like a polyneuropathia, when they really are having already sensory problems, and they cannot really detect that the temperature is really too cold. Nowadays, there are even more units out there, more efficiency in terms of cooling, temperature control, UV air filtering, limb cooling. These are things which are possible to have out there in terms of the cooling of the body. Indications, everything you have in musculoskeletal disorders. We work on trigger points. We talk especially about muscle tendon problems, We work on edemas. We do sometimes short-term cooling, but it's a mix of cooling. What we do an active combination, meaning that we work short-term and then long-term, and if possible, we like to have always the activation. Like we always want to get the people in an activated situation. We want to make them work. We want to make them train. We want to give them the mind again, what we had, a piece of love. We won't really have this optimism. The people have to go out. They see, oh man, I have finally been able to walk like with my knee 10 meters. So wow, that's very good without any pain. This is where we want to get the people. We want to have this positive loop, and there the cold in whichever way we use the cold can really help us a lot. Dr. Yamaguchi, again, keep in mind whole body cryotherapy from the beginning. We had talking about polyarthritis, okay, working on the complete body to really have this release of endorphins, to have this blood movement, to have this strong vascularization effect, which will then lead to a reduced muscle spasm and less pain. And for these people who have polyarthritis, of course, this can mean a lot of many things, because at the end, many of these people really take NSAIDs like all through their life. Yeah, they start the morning with some pills, they end the evening with some pills to really not have to pain, and then they might run into problems with the digestive system. So what we know also is that cold air, cooling of the body, can really help to reduce the consumption of of painkillers quite a bit. Relative contraindications, precautions, what we look at, of course, is for kids and elderly people that if we work with cold, that we keep the other body parts warm. We pay attention when we work close to the face, that we don't work on the ice. Work, of course, with heart problems a little bit in a different way for people with a cardiac crisis in the last 3 months. They're not allowed to go into the whole body cryotherapy chamber unless a doctor has been allowing this. Other contraindications: pheobulinemia, cold urticaria, Raynaud's disease. These are, I guess, to you known problems of the body which have problems with the vascularization, which can also be a vegetative nervous system problem. But these are the parts where we have to pay attention to. Going now from the small cooling to the bigger cooling, basics of whole body cryotherapy. Explanation: whole body cryotherapy. Consensus on whole body cryotherapy means that we talk about a range of temperatures of around about -100 to -150 degrees. Nowadays, what we saw in the studies is that even on temperatures around about -80, we already have this kind of strong effects on the complete body. So working on that, we have typically 3 fields. Again, we'll work with whole body cryotherapy. We talk musculoskeletal, talk about arthritis, we talk about pain management, post-surgery, and also to have an effect in neurology, where the people have multiple problems with their nervous system, to reduce kind of these effects. In wellness, it's about psychosomatic disorders, maybe to some degree. So we try to get the brain, the mental situation better by giving a positive feedback from the body. Okay, this endorphins, the positivity, that the people have a good feeling about their body. Some people have problems because they don't like their body. They have a problem with their body. Then what we try to do is, of course, that the people are happy with the body they have, they live in, and try to fight a little bit the problem zones of their body, but not being really so affected that they end up maybe with sleep disorders, stress, dermatology, where we like have very inflamed skin. Like, okay, we have to look at the complete body to get the inflammatory status of the body really down. And the best way to do it, of course, is a whole body cryotherapy approach. In sports, we talk about endurance. We talk, first of all, of course, about recovery after the training, but also endurance. How's the adaptation of the heart, of the cardiovascular system, and try to keep the injury level low and the immune system, of course, high. If we can really or afford to have like this very short amount of coolings in there, the vasculomotoric training is an important part also, that the people don't get sick that easily, right? On body level functions, what do we see? Of course, pain, edema, muscle spasm, healing overall, where we use the cold, the whole body cryotherapy, sleep, stress hormones, relaxation, cardiovascular adaptations, and stress hormones. So here's some of the main basic informations about the whole body cryotherapy. We talk again about the cold shock. We talk about the complete body activation. We talk about, okay, what should we be doing, or what can we do, or what have we to do in terms of how does it look like? Yeah, it looks like they already, the people are going like they're going into a pool area. So they have to wear like shorts or bikini. They will wear gloves. They will wear a mask, ear protection, and shoes. Maximum time in the ice lab at minus 120 roundabout is really maximum 3 minutes. Keep in mind the body has to adapt step by step. It takes around about 1-2 weeks till the body starts really adapting better, and the blood vessels, the motoric parts of the blood vessels start really um, to work to get better. Different systems out there. What you see, you have gas systems, nitrogen systems, you have electric systems. Here you have different aspects in terms of space. You have different aspects in terms of quality, um, yeah, energy consumption, effectivity. So there are different aspects out there what you have to keep in mind, and you should talk to people like healthcare who have a very long experience in this field, to understand um, what what are the options out there in terms of investment, return of investment, and really what is the best in terms of therapy. All right, different systems out there. This is an example of a gas system. What you see here is that the gas system typically is filled with gas. Yeah, here you have to strongly pay attention, of course, that you don't inhale this gas. So the people are there up to their maximum, their shoulders, to really have this cooling. The outlet of the gas is typically at the side, which can be as strong as minus 140 degrees. It's being put in to the cabin at the side. There you have a very strong cooling. So there are small aspects, again, where you have to be careful. It's an option. It's a very cost effective option in terms of purchase prices. Systems out there are around 50,000 euros maybe, but consume quite a bit of gas over the time. Where on the other hand, you have electrical systems which cost more at the beginning in an investment, but then later on, depending on the electric prices, are a lot cheaper. Here, what you see are thermal pictures in terms of hot and cold, the body reaction really going complete inside of the body, the chamber, excuse me. And the other part is really where the head and the shoulders are out of the system. So the reactions of the whole body cryotherapy overall is quite stronger, a lot stronger, and has a long lasting, the effect is a lot better. Here's some more examples. I will just run through that quickly about the skin temperature, surface temperature on different levels, where you see it. in combination of what kind of temperature or room temperature you are in, you have what kind of temperature on the skin. It's kind of interesting to see that really you get a very cold temperature on the skin for a short amount of time if you are really at minus 120 degrees. Study level, what you see out there is also there. We can forward that to you also here. A quick video of one of the chambers out there, which is like a video, I think it's from Prague, if I'm not mistaken, which is also, yeah, a very, very beautiful city. And you see here like a typical how it's done, that the people after sports they go to the clinic, um, they get dressed in the right way, they really get it set up in the right way. They could get a short intervention with the doctor, really seeing, okay, how is the cardiac situation, how's the blood pressure, overall, a quick introduction about what we do, how we do it, and then um, preparation, necessary preparation, like protecting the mouth, protecting the ears, um, um, wearing gloves, and then they go into this single chamber, ice chamber. So this is the way it typically goes. It's going to be opened up. The people will go in there, stay in there for a certain amount of time. The idea is that they are really moving a little bit inside of a chamber like this, and then when they get out, they get again some clothing on, no warm water, just clothing, and then they keep moving again. All right, I gotta hurry up. It's slowly coming to an end. Here, funny picture to the end, or funny and also pretty amazing picture is like there are also options out there for cold air for race horses out there, which is kind of amazing to see. More information to be found here on the site. More information on YouTube. You get more information on PubMed. All different types of studies out there prove like this kind of strong effect of the whole body cryotherapy. For the local cryotherapy, you also get more information. You get information in terms of protocols, more information in terms of how to deal with what kind of disease, how to use these kinds of nozzles, cold air, in which way, at what time. Um, what you see here now is a quick video of combination. At the end now, what we have here is um, is a quick video combination of shockwave with cold air. This is one of the combinations we use at the same time. The radio shockwave, obviously, in combination with cold air. What else do we have? Of course, what we see out there is the cryo and the laser combination. The big advantage here is that the risk of burning the skin is reduced, and especially if you work on high intensities start from our perspective round about at 7 watt. Anytime we go higher, the risk of burning is decreased, and the effectivity on high pain level problems is a lot better than with the laser alone. Some of the burning situation, what you see here. Coming to an end now, summing it up. Cryo for many years is part of our work over here, working with acute and with chronic disorders. We find it in all different types of fields: dermatology, neurology, traumatology, sports medicine, with a nice picture of Ulm, the city where I live in. I thank you very much for your attention. Stay healthy. And last but not least, please confirm your attendance by scanning the QR code. I leave this picture on now for a few seconds till you guys have finalized the scan, and then I leave it open to healthcare. Again, thank you very much, healthcare, for having me, giving us the opportunity to give you some brief introduction about cold air, about what we do, how we do it. I think if you have any further question, please contact Mr. Joe Lee. Either if you cannot have the QR code, you won't need it, or if you want to have more information on this. So thank you very much again. I hope your evening is going to be a nice evening with a nice temperature out there. And from my side, thank you very much for your attention.
Thank you for joining us today for this insightful cryotherapy webinar. A huge thank you to Mr. Ralf Mühlhäuser for sharing his expertise. We hope you gained valuable insights. For questions or more information, please contact us at 95775-178 or visit www.healthcarehk.com. We appreciate your participation. Thank you. Thank you for joining.
um, we have now a few more minutes time for question and answers. If you have a specific question, please type into the chat, which is below at your screen. In terms of, oh, there's already a question. Few. Sleep disorders, how does it help? First of all, it helps in terms of sleep disorders with a balance of activation and deactivation. Helps in terms of the blood flow overall, that a certain, if the person is in a stress situation, the vasomotoric effects are ongoing like that of a person with a chronic inflammation overall inside of the body. What it helps us, of course, that it helps the body to react two ways. First of all, it releases endorphins, which then, of course, working against these kinds of stress hormones, making the body feel happy or light, the body feel light, and the mental part is going to be more active and more relaxed. Furthermore, after this kind of sensation, then when the blood flow kicks in again, and the vasomotoric reaction is going into the different way, the people typically fall asleep right away. So we do this in a way that a few times over a week, and the people overall, straight from the first intervention, could say like 80% react straight away in a very positive way, that the sleep will get better. And not necessarily longer at the beginning, because some people wake up at night, they cannot sleep through, they cannot sleep longer than 3-4 hours in a row, but the sleep will get better at the beginning. And then after a few days of intervention, the sleep will also get longer. In terms of the QR code, I think please contact healthcare, Mr. Joe Lee. I think if you can do that, otherwise I'm sure they will send out a mail to everybody who has participated if you have left your email, send out this kind of picture. Yes, the effect, not a question, the effect of that whole body cryotherapy is many times stronger than the effect of the cold water. It has a similar effect, but not as strong as the whole body cryotherapy at minus 120 or minus 110 degrees. Yeah, keep in mind the adaptation of the mesomotoric parts takes 1 to 2 weeks minimum. At the beginning, what you should be doing is really that you should be working on small partial cooling, meaning you start with the limbs, start maybe with water walking at the beginning. So you train your cardiovascular system, and then step by step, you after 1 2 weeks, you can also enter whole body cryotherapy. So that would be the right way to do it, to really go step by step, partial cooling and then whole body cooling. Yeah, the combination therapy overall, the combination in the cold air reduces the burning sensations or the burning cases when used with the laser by 80%. All right. I think we'll slowly come to an end. Thank you very much again for your attention. For any more questions or answers to your questions, please contact healthcare. We'll support them catching up with your questions. Thank you very much and have a nice evening. Bye-bye.